I'm Dr. Rena Loeb, urologist and men's health physician, and on this channel we talk about health with honesty, clarity, and science. My mission is to help men understand not just what's happening in their bodies, but why it's happening and what they can do about it before disease takes control. So if you're here to learn, to take responsibility for your health, and to age with strength and awareness, you're in the right place. Welcome. Today we're going to talk about something that every man over 40 should know, yet almost no one is told in the doctor's office. The foods you eat every day can silently inflame your prostate. Not just irritate it short-term, but create a long-term inflammatory state that increases the risk of prostatitis, benign prostatic enlargement, urinary symptoms, hormone imbalance, and, over time, a cellular environment that may raise the risk for prostate cancer. Prostate inflammation does not happen overnight. It builds slowly, quietly, and systemically. It's not just about the prostate. It's about the immune response, the liver, the bloodstream, the microbiome, the hormones, and most importantly, the diet. Most men do not feel the beginning of prostate inflammation. They don't feel the slow rise in inflammatory markers like IL-6 and TNF-alpha. They don't feel the metabolic stress caused by insulin spikes. They don't feel the hormonal shifts that change how testosterone and DHT behave inside the prostate. What they do feel, years later, are the symptoms: pelvic discomfort, frequent urination at night, weak or interrupted urinary flow, pressure in the lower abdomen, reduced ejaculation force, aching after sex, and a gradual decline in sexual vitality. And this is where diet enters the story, because long before the prostate becomes symptomatic, inflammation is already there. And it is being fed. So today, we are not going to talk about supplements or pills or quick fix solutions. We are going to talk about the 5 foods that have the strongest scientific association with chronic prostate inflammation and the biological reasons why they do so. Not myths, not trends, evidence. Let's begin by understanding one key point. The prostate is not just a gland. It is a hormone-sensitive, inflammation-responsive, immune-active organ that reacts to what enters your bloodstream. Every bite you take either calms inflammation or fuels it. And now, let's explore the first group of foods silently inflaming the prostate. The first is highly processed seed oils and foods cooked in them. Oils like soybean, corn, sunflower, safflower, canola, and cottonseed oil. These oils are extremely high in omega-6 fatty acids, especially linoleic acid. In small amounts, omega-6 is necessary. In excess, it becomes inflammatory. When heated, especially at high temperatures, these oils oxidize and form toxic compounds called aldehydes. These aldehydes enter the bloodstream, attach to cell membranes, and trigger an immune response that raises inflammatory cytokines, including those that directly affect prostate tissue. Studies published in the Journal of Urology and Prostate Cancer and Prostatic Diseases show that men with higher omega-6 to omega-3 ratios have higher rates of prostate enlargement and chronic prostatitis. It's not just what you eat, it's what your food is cooked in. The second food category linked to prostate inflammation is high-fat dairy, especially from conventionally raised cows. Whole milk, cheese, ice cream, butter, cream, particularly when coming from A1 casein dairy, are associated with increased levels of IGF-1, a growth hormone that stimulates prostate tissue growth. Dairy fat also increases DHT, the more potent form of testosterone that thickens and enlarges prostate cells. Several large-scale studies, including one from Harvard involving over 21,000 men, found that high consumption of full-fat dairy products was associated with a significantly increased risk of both BPH and aggressive prostate cancer. The reason is not just the fat content, it's the hormones, inflammation, and growth signals attached to them. The third category is processed meats. Sausages, bacon, deli meats, pepperoni, hot dogs, and especially meats cooked at very high temperatures until charred. These foods contain nitrates, nitrites, advanced glycation end products, and heterocyclic amines, all compounds linked to prostate inflammation and DNA damage. A 2022 study in the journal Nutrients showed that men who consumed the highest amount of processed meats had 30 to 40% higher markers of prostate inflammation than those who rarely ate them. Another study from the American Association for Cancer Research linked frequent consumption of charred red meat to a higher rate of prostate cell mutation. It's not the protein that's harmful. It's the chemical transformation caused by processing and extreme cooking. The fourth food on the list is alcohol, especially when consumed frequently. Alcohol depletes zinc, a mineral highly concentrated in the prostate and essential for protecting it against oxidative stress. Alcohol also raises estrogen, lowers testosterone, disrupts liver detoxification, and leads to leaky gut inflammation that circulates straight to the prostate through the bloodstream. Beer, in particular, has been associated with increased risk of BPH due to phytoestrogen activity from hops. Chronic alcohol use also increases CRP and IL-6, markers consistently elevated in men with chronic prostatitis. The fifth and final trigger food is refined sugar and high glycemic carbohydrates, foods that spike insulin, promote fat storage, and drive chronic inflammation through metabolic dysfunction. When blood sugar rises sharply, insulin rises with it, and insulin is not just a metabolic hormone, it is a growth signal. High insulin and high blood sugar both promote the conversion of testosterone into DHT inside the prostate, the same hormone that drives enlargement and inflammation. Men with insulin resistance have significantly higher rates of prostatitis, BPH, erectile dysfunction, and prostate cancer. In fact, a study in the Journal of Clinical Oncology showed that men with the highest glucose instability had the fastest prostate growth and worst urinary symptoms. Sugar is not just a problem for diabetes, it is a prostate inflammatory fuel. Now let's connect everything. All 5 of these foods, processed oils, high-fat dairy, processed meats, alcohol, and refined sugar, contribute to the same systems of dysfunction: inflammation, hormone imbalance, oxidative stress, insulin elevation, and immune disruption. That's why they don't just inflame the prostate, they inflame the entire body. And here is an important truth. Prostate inflammation rarely exists alone. It travels with metabolic syndrome, low testosterone, endothelial dysfunction, fatty liver, gut imbalance, and low-grade chronic inflammation, and diet is always the common trigger. That is why addressing prostate health is not just about treating the prostate, it's about treating the man. So what can you do? The first step is not panic, it is awareness. The prostate is responsive. It calms when inflammation drops. It shrinks when insulin normalizes. It heals when zinc rises. It improves when blood flow improves. And yes, it responds when inflammatory foods are removed. You do not have to be perfect, but you do have to be conscious. If you want your prostate to stay healthy as you age, here are the principles that matter most. Eat real food, not engineered food. Choose anti-inflammatory fats like olive oil and avocado instead of seed oils. Replace processed meats with clean, uncharred proteins. Choose plant-based calcium and fermented dairy if you consume dairy. Keep blood sugar stable. Limit alcohol. Feed your body antioxidants, fiber, minerals, and omega-3s. And most importantly, don't wait for symptoms to start caring. Because when the prostate becomes inflamed enough for you to feel it, the inflammation has already been there for a long time. So, before we close, ask yourself, is my diet feeding health or feeding inflammation? That question is bigger than prostate health. It's a question about longevity. I'm Dr. Rena Loeb. Thank you for watching. Thank you for taking your health seriously. And thank you for being part of a generation of men who finally understand that prevention is not weakness, it is wisdom. Take care of your body now, and your body will take care of you later. I'll see you in the next video.